Bloemfontein, of course, is being closely monitored, which is in Mangaung. Bloemfontein is Mangaung. Let's discuss this now with Professor Shabhir Madhi, Director of the MRC Respiratory and Meningeal Pathogens Research Unit. Good evening, Prof. Today on our television screens in Mangaung, we saw many supporters of Ace Magashule gathered, singing, close together, lots of them not wearing masks. Could this be, bearing in mind that Mangaung is a worrying area for COVID, could this be a potential super spreader event?
The unfortunate reality is that that type of behavior is exactly what is probably leading to the resurgence in places such as the Eastern Cape. The only good thing about it is that it's something that has happened outdoors. But certainly when you get that number of people gathering, and particularly if they're in close proximity, and more so if they're in indoors and poorly ventilated areas, it certainly is what is going to lend to a resurgence much sooner rather than later.
What is the hospitalization situation in and around Mangaung at the moment?
So Mangaung, fortunately, is better off than Nelson Mandela Bay, based on the data from the NICD. They don't have exact numbers in terms of bed occupancy, but just looking at hospitalization rates, it certainly is nowhere close to where the Eastern Cape, particularly Nelson Mandela Bay, is currently relative to what it was experienced in the first wave of the outbreak.
What is the latest news from Nelson Mandela Bay?
So we're seeing a situation where both in the public as well as the private sector, it appears that even for ICU, they're nearing a maximum occupancy, which is really problematic and quite surprising. But quite surprising in that, unfortunately, what probably led to it is the behavior of South Africans. A lockdown, as an example, is not going to achieve much if people go back to behaving as if we're in a pre-COVID era, don't adhere to the wearing of face masks, don't avoid mass gatherings, don't avoid being in close, poorly ventilated areas. All that the lockdown would do is, again, delay this inevitable sort of resurgence that will occur once people become lax about these non-pharmaceutical interventions.
It's interesting you mentioned the lockdowns, because right at the beginning of our COVID crisis, regional lockdowns or postcode lockdowns were something that were part of the option of tools that we could use. We've never actually gone into a regional or a city lockdown, but we are seeing it being used in other countries. And it seems what it does, it gives a bit of a circuit breaker, a potential breathing space, which might take some pressure on hospitals. Is it something that's being considered for Nelson Mandela Bay?
So obviously I'm no longer on the Ministerial Advisory Committee, so I'm not too sure what the deliberations are, but certainly, as you pointed out, that would be the only reason for going into high levels of restriction, to try to slow the rate of the transmission of the virus so there can be some breathing space in terms of healthcare facility utilization. But again, the problem with that sort of an approach, it doesn't address the root cause of the resurgence. And all that will happen is that when that lockdown is phased out, and if people return to the behavior as if we're in a pre-COVID era, we're just going to face another resurgence and we would need to repeat the lockdown. So unfortunately, if the situation arises that hospitals are completely overwhelmed, there probably is going to be little option for those specific localities other than to try to break that chain of transmission by going into higher levels of restriction. Something that we should avoid, but something that might happen if people aren't careful enough.
Can you talk to us about the latest news on national antibody surveys? I know that we've had some spot regional surveys, but there was meant to be a national survey on antibodies and how many of us actually have the antibodies, because that could give us at least some limited immunity. What's the latest?
Right, so in Gauteng, we've actually started a survey. We're assisting the Gauteng Department of Health, and we're doing it at the sub-district level, which means for each locality, we would be able to identify exactly what percentage of the population have been previously infected, which will assist us in terms of getting an estimate as to what percentage of the population probably got some level of immunity. For the rest of the country, I'm not too aware as to exactly where they are with the sero survey. The problem with the sero survey is that if you don't do it soon enough, you end up in a situation where you would get lots of false negatives. And the reason for that is many people that have mild infection or asymptomatic infection that antibody wanes fairly rapidly after 4 to 6 weeks. So if there's a delay on the part of provinces in terms of doing this sort of a survey, doing it 3-4 months later after the peak, it in fact has limited value and could be misleading in terms of the number of people that were infected the first time round. So provinces really need to up their game if they're wanting to do this, and I think it's of absolute value to do it as soon as possible.
Of course, we're all holding out hopes of that Pfizer vaccine, but we know that's still quite a few months down the line. What's the latest on the VITS vaccine trial?
So we're hoping that at least for one of the 2 studies that we would be able to analyze before the end of this year. And then for the other study, we're probably looking at analyzing sometime in the first quarter of next year. Obviously, much of it is dependent on how soon the participants, or at least some small percentage of them, end up developing COVID-19. And that is by virtue of the nature of the design of the studies. But we're hoping to be able to provide answers at least for one of the 2 vaccines before the end of this year.
Well, thank you very much for coming through to us this evening. That was Professor Shabhir Madhi, Director of the MRC Respiratory and Meningeal Pathogens Research Unit.